So this is our update on the COVID-19 situation here in British Columbia. For today, we have 25 new test positive cases here in BC for a total number of cases of 1,291. That includes 603 people in the Vancouver Coastal Health Region, 458 at the Fraser Health Region, and no change in the other three health regions, 79 on Vancouver Island, 128 people in Interior Health, and 23 people in Northern Health. We also have no new long-term care outbreaks today. We remain with 21, and currently there are 213 people in long-term care who have tested positive for COVID-19. That's 132 residents and 81 staff people. Right now, there are 138 people hospitalized with COVID-19 in British Columbia, and of those, 66 are in intensive care unit or critical care units. We have, sadly, another 4 people who have died from COVID-19 in the last day here in BC, 3 people in Vancouver Coastal Health and 1 in the Fraser Health Region. And 805 people have fully recovered and are no longer in isolation. So as we're all aware, there are a number of important religious celebrations that are coming up in the coming weeks, starting tomorrow, really, and in the coming days. And many of us, millions around the world of many faiths, will be celebrating these major religious holidays. And we'll be celebrating collectively around the world in ways we've never done before, in many cases. Our faith leaders, and we had a call with a number of faith leaders from across BC again this morning, are also community leaders and people that we look to for guidance at these times when we're in crises, but also when we have times of these religious celebrations. And I am so happy to see and have been so impressed by how much they have shown through their actions that we can still celebrate and care for those around us in virtual ways. And as a matter of fact, many more people during this time are finding ways to connect with people online through their religious faith, through many different religious faiths. And I encourage people to continue to look for those connections online. We've heard that many places have areas online that people can connect to, so I would encourage you to find those numbers. The followers and congregations around the province here in British Columbia, please, now is our time that we need to pay special attention to our elders and seniors. Our elders hold our history, our language, and our traditions, and are a precious part of our communities around this province. And through these celebrations over the coming weeks, please keep that in mind so that we can maintain our safe distance to protect them. We protect them by connecting safely from a distance. And that is an important thing for us all to remember. This is also a time, I know, when many people will be thinking of traveling and going to perhaps holiday homes or smaller communities around the province. And I really am imploring people, this is not our time to do that right now. We need to avoid all non-essential travel, and it's important that we don't go to communities where we might not have the resources to support us if we become sick or if there's a medical emergency. So now is the time to stay home, to stay connected with our family, to stay connected virtually. I also want to say that, group celebrations inside are also problematic at this time. And while we have an order that prohibits gatherings of more than 50, right now, when we know that this virus continues to circulate in our communities, coming together of even small groups can be very problematic. And if you are coming together as a small group, maintaining those distances, making sure you're doing the things we need you to do, like cleaning your hands regularly, making sure you're covering your cough, that if you are feeling at all unwell, that you do not go and do not bring this into an environment with others. I also want to say today is World Health Day, which is a WHO day where we talk about awareness of health around the world. And I can't imagine more people being aware of health at this point in the world right now. But many people we know in British Columbia are managing chronic disease and other health issues. And I can encourage you to continue to work with your healthcare providers, to talk to your physician's office, your primary care provider's office, or if you don't have a primary care provider, to talk to the UPCCs, to call 811 if you need. It's okay for each of us to reach out, and you can do it safely. You can do it online in many cases, and there are many resources and options for care available for people online now through our community physicians, our family physicians, and community organizations. I encourage you as well to connect with your family physician, the people who know you best and know your condition best during this time. And if you do need urgent care, the emergency departments are there to support you, and 911 and our paramedic services are there to support you. So do not be afraid to, because of COVID-19, to call for help if you need it. Finally, I just, this is, as I've been saying in the last few days, we're in the thick of it right now. We need to continue to stay united and to stay strong. And as we look ahead to these celebrations with families and friends, let's keep our firewall strong. So this is our time to care and protect each other and our communities and our families across BC. I did want to add one other thing that has been brought to my attention, and they say the number one thing not to do in a pandemic is your own hair, and I will say believe them. And my apologies to Lindsay, my hairdresser, but I did do some of my own tinkering with my hair in the last couple of days. So yes, I did not go to the hairdressers, and hopefully it will settle down soon. But so. Thank you, and remind you all to, this is a time for us to be kind and to be calm and to stay safe.